Comprehensive NCLEX RN Practice Exam 8 2026. Question 1. A 21-year-old male with Hodgkin's lymphoma is a senior at the local university. He is engaged to be married and is to begin a new job upon graduation. Which of the following diagnoses would be a priority for this client? A. Sexual dysfunction related to radiation therapy. B. Anticipatory grieving related to terminal illness. C. Tissue integrity related to prolonged bed rest. D. Fatigue related to chemotherapy. Fatigue is the most common and distressing side effect of chemotherapy, significantly impacting a young adult's ability to maintain their role as a student and prepare for a career. Question 2. A client has autoimmune thrombocytopenic purpura. To determine the client's response to treatment, the nurse would monitor A. Platelet count. B. White blood cell count. C. Potassium levels. D. Partial prothrombin time, PTT. Autoimmune thrombocytopenic purpura, ITP, is a condition where the body destroys its own platelets. The effectiveness of treatment is measured by the recovery of the platelet count. Question 3. The home health nurse is visiting a client with autoimmune thrombocytopenic purpura, ATP. The client's platelet count currently is 80. It will be most important to teach the client and family about A. Bleeding precautions. B. Prevention of falls. C. Oxygen therapy. D. Conservation of energy. A platelet count of 80,000, is below the normal range, 150,000 to 400,000. The primary safety concern for a client with thrombocytopenia is the risk of bleeding. Question 4. A client with a pituitary tumor has had transsphenoidal hypophysectomy. Which of the following interventions would be appropriate for this client? A. Place the client in Trendelenburg position for postural drainage. B. Encourage coughing and deep breathing every 2 hours. C. Elevate the head of the bed 30 degrees. D. Encourage the Valsalva maneuver for bowel movements. Elevating the head of the bed reduces intracranial pressure and decreases the strain on the surgical site at the sella turcica. Coughing and Valsalva are avoided to prevent CSF leaks. Question 5. The client with a history of diabetes insipidus is admitted with polyuria, polydipsia, and mental confusion. The priority intervention for this client is A. Measure the urinary output. B. Check the vital signs. C. Encourage increased fluid intake. D. Weigh the client. Diabetes insipidus can lead to massive fluid loss and hypovolemic shock. Checking vital signs is the priority to assess for hemodynamic stability and dehydration. Question 6. A client with hemophilia has a nosebleed. Which nursing action is most appropriate to control the bleeding? A. Place the client in a sitting position with the head hyperextended. B. Pack the nares tightly with gauze to apply pressure to the source of bleeding. C. Pinch the soft lower part of the nose for a minimum of 5 minutes. D. Apply ice packs to the forehead and back of the neck. Applying direct pressure by pinching the soft part of the nose is the standard first aid treatment for epistaxis and is effective even in clients with bleeding disorders. Question 7. A client has had a unilateral adrenalectomy to remove a tumor. To prevent complications, the most important measurement in the immediate postoperative period for the nurse to take is A. Blood pressure. B. Temperature. C. The output. D. Specific gravity. Adrenal surgery can cause sudden fluctuations in catecholamine and cortisol levels, leading to severe hypertension or hypotension. Frequent blood pressure monitoring is vital. Question 8. A client with Addison's disease has been admitted with a history of nausea and vomiting for the past 3 days. The client is receiving 4 glucocorticoids, Solomedrol. Which of the following interventions would the nurse implement? A. Daily weights. B. Intake/output measurements. C. Sodium and potassium levels monitored. D. Glucometer readings as ordered. Glucocorticoids, steroids, naturally increase blood glucose levels. Monitoring blood sugar is a standard intervention for any client receiving 4 steroid therapy. Question 9. A client had a total thyroidectomy yesterday. The client is complaining of tingling around the mouth and in the fingers and toes. What would the nurse's next action be? A. Obtain a crash cart. B. Check the calcium level. C. Assess the dressing for drainage. D. Assess the blood pressure for hypertension. Tingling, paresthesia, around the mouth and extremities is a sign of hypocalcemia, which occurs if the parathyroid glands are accidentally damaged or removed during a thyroidectomy. Question 10. A 32-year-old mother of 3 is brought to the clinic. Her pulse is 52, there is a weight gain of 30 pounds in 4 months, and the client is wearing 2 sweaters. The client is diagnosed with hypothyroidism. Which of the following nursing diagnoses is of highest priority? A. Impaired physical mobility related to decreased endurance. B. Hypothermia r/T decreased metabolic rate. C. Disturbed thought processes r/T interstitial edema. D. Decreased cardiac output r/T bradycardia. Severe bradycardia, pulse 52, associated with hypothyroidism can lead to decreased cardiac output and, in extreme cases, myxedema coma. This is the highest physiological priority. Question 11. The client is having an arteriogram. During the procedure, the client tells the nurse, "I'm feeling really hot." Which response would be best? A. You are having an allergic reaction. I will get an order for Benadryl. B. That feeling of warmth is normal when the dye is injected. C. That feeling of warmth indicates that the clots in the coronary vessels are dissolving. D. I will tell your doctor and let him explain to you the reason for the hot feeling that you are experiencing. The injection of radiopaque contrast medium, dye, commonly causes a transient flushing or warm sensation throughout the body. Question 12. The nurse is observing several healthcare workers providing care. Which action by the healthcare worker indicates a need for further teaching? A. The nursing assistant wears gloves while giving the client a bath. B. The nurse wears goggles while drawing blood from the client. C. The doctor washes his hands before examining the client. D. The nurse wears gloves to take the client's vital signs. Standard precautions do not require gloves for non-invasive procedures like taking vital signs unless there is an expectation of contact with broken skin or body fluids. Question 13. The client is having electroconvulsive therapy for treatment of severe depression. Which of the following indicates that the client's ECT has been effective? A. The client loses consciousness. B. The client vomits. C. The client's ECG indicates tachycardia. D. The client has a grand mal seizure. For electroconvulsive therapy to be therapeutically effective, a generalized grand mal seizure must be induced. Question 14. The 5-year-old is being tested for enterobiasis, pinworms. To collect a specimen for assessment of pinworms, the nurse should teach the mother to A. Examine the perianal area with a flashlight 2 or 3 hours after the child is asleep. B. Scrape the skin with a piece of cardboard and bring it to the clinic. C. Obtain a stool specimen in the afternoon. D. Bring a hair sample to the clinic for evaluation. Female pinworms migrate out of the anus at night to lay eggs. Examining the area or using a tape test while the child is asleep is the most accurate way to find them. Question 15. The nurse is teaching the mother regarding treatment for enterobiasis. Which instruction should be given regarding the medication? A. Treatment is not recommended for children less than 10 years of age. B. The entire family should be treated. C. Medication therapy will continue for 1 year. D. Intravenous antibiotic therapy will be ordered. Enterobiasis, pinworms, is highly contagious and spreads easily within a household. To prevent reinfection, all family members should be treated simultaneously. Question 16. The registered nurse is making assignments for the day. Which client should be assigned to the pregnant nurse? A. The client receiving linear accelerator radiation therapy for lung cancer. B. The client with a radium implant for cervical cancer. C. The client who has just been administered soluble brachytherapy for thyroid cancer. D. The client who returned from placement of iridium seeds for prostate cancer. External radiation from a linear accelerator does not make the client radioactive. Internal implants, radium, iridium, or soluble isotopes, pose a radiation risk to the fetus. Question 17. The nurse is planning room assignments for the day. Which client should be assigned to a private room if only one is available? A. The client with Cushing's disease. B. The client with diabetes. C. The client with acromegaly. D. The client with myxedema. Cushing's disease involves high levels of cortisol, which suppresses the immune system. This client is highly susceptible to infection and should be protected from other ill patients. Question 18. The nurse caring for a client in the neonatal intensive care unit administers adult strength digitalis to the 3-pound infant. As a result of her actions, the baby suffers permanent heart and brain damage. The nurse can be charged with A. Negligence, B. Tort, C. Assault, D. Malpractice. Malpractice is professional negligence that occurs when a licensed professional fails to follow the standard of care, resulting in injury to the patient. Question 19. Which assignment should not be performed by the licensed practical nurse? A. Inserting a Foley catheter. B. Discontinuing a nasogastric tube. C. Obtaining a sputum specimen. D. Starting a blood transfusion. Initiating and monitoring blood transfusions is within the scope of practice of a registered nurse, RN, and is generally prohibited for LPNs. Question 20. The client returns to the unit from surgery with a blood pressure of 90/50ths, pulse 132, and respirations 30. Which action by the nurse should receive priority? A. Continuing to monitor the vital signs. B. Contacting the physician. C. Asking the client how he feels. D. Asking the LPN to continue the post-op care. These vital signs indicate tachycardia, hypotension, and tachypnea, which are classic signs of hemorrhage or shock. This is a medical emergency requiring the physician. Question 21. Which nurse should be assigned to care for the postpartum client with preeclampsia? A. The RN with 2 weeks of experience in postpartum. B. The RN with 3 years of experience in labor and delivery. C. The RN with 10 years of experience in surgery. D. The RN with 1 year of experience in the neonatal intensive care unit. Labor and delivery nurses are highly skilled in managing preeclampsia and the administration of magnesium sulfate, which is common in the postpartum phase of this condition. Question 22. Which information should be reported to the State Board of Nursing? A. The facility fails to provide literature in both Spanish and English. B. The narcotic count has been incorrect on the unit for the past 3 days. C. The client fails to receive an itemized account of his bills and services received during his hospital stay. D. The nursing assistant assigned to the client with hepatitis fails to feed the client and give the bath. Discrepancies in controlled substance counts suggest potential drug diversion or gross negligence, both of which must be reported to the State Board of Nursing. Question 23. The nurse is suspected of charting medication administration that he did not give. After talking to the nurse, the charge nurse should A. Call the Board of Nursing. B. File a formal reprimand. C. Terminate the nurse. D. Charge the nurse with a tort. Documentation of care not provided is falsification of medical records. After initial communication, a formal administrative reprimand is the standard next step in a disciplinary process. Question 24. The home health nurse is planning for the day's visits. Which client should be seen first? A. The 78-year-old who had a gastrectomy 3 weeks ago and has a PEG tube. B. The 5-month-old discharged 1 week ago with pneumonia who is being treated with amoxicillin liquid suspension. C. The 50-year-old with MRSA being treated with vancomycin via a PICC line. D. The 30-year-old with an exacerbation of multiple sclerosis being treated with cortisone via a centrally placed venous catheter. Acute exacerbation of a chronic condition, MS, being treated via a central venous catheter requires priority assessment for both the clinical condition and the high-risk 4-access site. Question 25. The emergency room is flooded with clients injured in a tornado. Which clients can be assigned to share a room in the emergency department during the disaster? A. A schizophrenic client having visual and auditory hallucinations and the client with ulcerative colitis. B. The client who is 6 months pregnant with abdominal pain and the client with facial lacerations and a broken arm. C. A child whose pupils are fixed and dilated and his parents, and a client with a frontal head injury. D. The client who arrives with a large puncture wound to the abdomen and the client with chest pain. The pregnant client and the client with lacerations/fractures are stable and non-contagious. They are the safest combination to share a limited space during a disaster. Question 26. The nurse is caring for a 6-year-old client admitted with a diagnosis of conjunctivitis. Before administering eye drops, the nurse should recognize that it is essential to consider which of the following. A. The eye should be cleansed with warm water, removing any exudate, before instilling the eye drops. B. The child should be allowed to instill his own eye drops. C. The mother should be allowed to instill the eye drops. D. If the eye is clear from any redness or edema, the eye drops should be held. Cleaning the eye first ensures that the medication reaches the ocular surface and is not blocked by crusts or purulent drainage. Question 27. The nurse is discussing meal planning with the mother of a 2-year-old toddler. Which of the following statements, if made by the mother, would require a need for further instruction? A. It is okay to give my child white grape juice for breakfast. B. My child can have a grilled cheese sandwich for lunch. C. We are going on a camping trip this weekend, and I have bought hot dogs to grill for his lunch. D. For a snack, my child can have ice cream. Hot dogs are a common choking hazard for toddlers due to their shape and texture. They should be cut into very small pieces or avoided. Question 28. A 2-year-old toddler is admitted to the hospital. Which of the following nursing interventions would you expect? A. Ask the parent/guardian to leave the room when assessments are being performed. B. Ask the parent/guardian to take the child's favorite blanket home because anything from the outside should not be brought into the hospital. C. Ask the parent/guardian to room in with the child. D. If the child is screaming, tell him this is inappropriate behavior. Toddlers experience significant separation anxiety. Encouraging the parent to room in provides security and reduces the trauma of hospitalization. Question 29. Which instruction should be given to the client who is fitted for a behind-the-ear hearing aid? A. Remove the mold and clean every week. B. Store the hearing aid in a warm place. C. Clean the lint from the hearing aid with a toothpick. D. Change the batteries weekly. To ensure consistent function, batteries in standard hearing aids are typically changed on a weekly basis. Question 30. A priority nursing diagnosis for a child being admitted from surgery following a tonsillectomy is A. Body image disturbance. B. Impaired verbal communication. C. Risk for aspiration. D. Pain. Post-tonsillectomy, the child is at high risk for aspiration due to potential bleeding and excessive secretions in the oropharynx.